This morning, I'm really excited to introduce our speaker today, Dr. Baruch Barzel. He is currently an assistant professor in the mathematics department and a core faculty of the Data Science Institute at Bar-Ilan University. And he completed his PhD in physics at the Hebrew University of Jerusalem as a Hoffman Fellow and had postdoctoral training at the Center for Complex Network Research at Northeastern University and at the Channing Division of Network Medicine at Harvard Medical School. Dr. Barzel's research focuses on the dynamic behavior of complex networks, uncovering universal principles that govern the dynamics of diverse systems such as disease spreading, gene regulatory networks, protein interactions, or population dynamics. And he has worked on a number of really interesting kind of universal network dynamic ideas. So the first one is he's worked on trying to understand complex systems through understanding the relative impact of network topology and the governing flow dynamics of the system. His work has also explored universal resilience patterns in complex networks, where his analytical results identified network characteristics that can alter resilience, offering ways to potentially prevent the collapse of ecological or biological and economic systems, and guiding design of technological systems resilient to internal failures and environmental changes. He's also carried out quite a bit of work looking at epidemic spreading dynamics. So he has identified formal dynamics where the flow of information or diseases are actually avoiding the hubs of networks and favoring the network's peripheral pathways. Which, as you know from many of the conversations we've had in the consortium, really departs from traditional thinking and thoughts on based on network topology alone. And finally, he's also looked at global pandemic spread alongside the spread of pharmaceuticals and tried to compare a centralized approach where pharmaceuticals are produced in a few central locations and distributed to the globe versus a decentralized approach where pharmaceuticals are kind of produced locally around the globe, and identified really interesting patterns that decentralized production was better able to combat the pandemic, both in terms of lives saved and cost. So he's drawn on this previous work to better understand mitigation strategies with COVID-19, which is what he'll be speaking about today. So with that, I'll let him take it away.
Thank you so much, Spencer. I have to say that this was such an introduction. I can't wait to hear what I have to say now. But let's see if I can full screen this. How do we mitigate COVID-19 without completely crippling the economy? That's the question we're asking today. And, so Spencer has brought a very good introduction. My lab usually deals with network science. We talk about neuronal networks, infrastructure networks, biological networks. But of course, since COVID-19 went into our lives, we're very much focused on social networks and on the spread of epidemics. And together with my lab, I think we came up with what I think is a game-changing strategy to sustain socioeconomic activity alongside the mitigation of COVID-19. Well, at least until we can vaccinate a major part of society. The idea is based on the notion of alternating quarantine. And let's cut right to the chase and say what it is. So here's how it works. You take society, and the first thing you do is you partition it into two groups. Cohort number 1, the red group, and cohort number 2, the blue group. And then you have these groups working alternating in weekly succession between socioeconomic activity and quarantine. So an example is worth 1,000 words. Let's just follow the schedule. So in week number 1, cohort number 1, the red group, they go to work. And cohort number 2, the other part of society, the blue group, they stay at home. They're in quarantine. And then in week number 2, they switch. And they keep on sustaining these alternations until eventually the numbers or the prevalence of the epidemic goes down to manageable levels. Now, why does it work so well? So there are two questions. The first question I just asked, why it works. And the second question, okay, the first question is, does it work? I'll try to convince you that it does. Another question you might have is that this sounds a little bit complicated. And I want you to wait because I'm going to talk about the implementation. It's way simpler than you think. But of course, if you want to benefit both from an economical perspective and from a mitigation perspective, you need to work hard. I mean, you need to design a strategy which is a little bit more difficult to implement than just the simplest alternatives. But before we talk about implementation, let's see why I claim that this works so well. So number one, you sustain a 50% economic activity. At every given point in time, half of the population goes to work. Also from the individual perspective, every individual is active 50% of the time. You only have to isolate for a week at a time. So you get a much more socioeconomic, manageable mitigation strategy. But that's the socioeconomic benefit. That's easy. What about the mitigation? So the reason this works well is for two factors. And we can understand these factors by thinking about alternatives. What are the alternatives that also provide mitigation alongside 50% economic activity? Well, one option is to partition society into two groups and have one group, the red group, all the time quarantine at home, and the other group, the blue group, sustain the economy going to work. Of course, this is very unfair, but let's face it, this is what most quarantines look like, because in most countries, even when they have a full lockdown, it's not very egalitarian. Some sectors, like if you run a restaurant or a small business, you really suffer. Well, if you're a university professor, it's kind of okay. You can somehow manage it, right? So let's talk about this. You take 50% of the population and lock them down, and the other 50% are active. Why would that work? Well, it works because you reduce the reproduction factor, R0, by a factor of 2 by diluting the interacting population. It's roughly a factor of 2. Why? Buses are half full, offices are half full, classrooms are half full. You only interact with half of your network, so you dilute the interacting population, and by that you reduce the reproduction number. So that's option number one. The other option to get a 50% economic activity is, again, something that most of us have been experiencing, the on and off. The intermittent quarantines. You don't partition society. Everyone stays at home for a week and then goes to work for a week, stays at home for a week and then goes to work for a week. And what you do here is you dilute the interaction duration. People interact for only half of the time, only 1 week out of 2. Once again, you cut down R0 roughly by a factor of 2. For COVID-19, we know that this is insufficient. It's not enough. Okay, now one thing to keep in mind in these diagrams, if you want to know how much of the economy is active, you just need to look at the blue area. Since 50% of the area is blue and 50% is red, then it means that you get a 50% net socioeconomic activity. What does alternating quarantine do? Well, it benefits from the best of both worlds. On the one hand, you partition society into two roughly non-interacting groups. So you dilute the interacting population. But on the other hand, each of these cohorts, each of this 50% of society works for a week and stays at home for a week, works for a week and stays at home for a week. So you also dilute the interaction time within each of these cohorts. You combine both of these together, what you get is a reduction of roughly 25% in R0. You cut down the disease by 4. But still, if you look at the blue area, you still get 50% blue. That means 50% socioeconomic activity. So roughly speaking, it's kind of a mathematical wizardry, but if you look at the combinatorial options, this is the optimal option. You get the most economy with the least disease. 25% COVID-19, but 50% socioeconomic activity. You can't beat that in terms of the combinatorics of combining social partitioning and time, intermittent activity in time. But there's another reason, because you see, we asked ourselves, don't worry about this, I'll unpack it in a second. We asked ourselves already back in March, why is this disease spreading so violently? So I know not all societies are the same, and I know that in the US situation is kind of different, but at least in Israel and in most European countries, if you were showing any symptoms, you were isolated. Nobody gets near you. If you're coughing or have a fever, of course, if you're hospitalized, people are very vigorously isolating the sick. Still, this virus manages to spread, and by now we all know why. The reason is that the virus has a secret weapon, which is called the pre-symptomatic phase. You see, infection, if you look at this purple column here, this is the COVID-19 disease cycle. And once you're exposed to the virus, before the onset of symptoms, you already start infecting others. So there are people who are pre-symptomatic. They did not develop symptoms yet, but they are already shedding the virus to their environment. We call them the invisible spreaders, okay? So I may already be infected, And I don't know that. So I'm not aware around my network. My network is not isolating itself from me. I keep on behaving as usual, even though I'm already spreading the virus. And it is in this purple window when the majority of the spread occurs. So what we need to do is isolate the invisible spreaders. But how would you do that? Well, you can't because they're invisible, right? And that's why we enforce population-wide lockdowns, because we cannot identify the invisible spreaders ahead of time. But the point with the alternating quarantine is that it kind of does that without any effort. It does it automatically. Let's see that by following the trajectory of a single person. So imagine that you're a person in cohort number 1, the blue group. So in week number 1, you go outside to work. Your kids go to school, you do your shopping, and you go down, you do your errands. Week number 1, you are active just like you were before March. Okay, so that's what you do in cohort number 1 in week number 1. You might have gotten infected in that week. And if you got infected, then within a couple of days, you're going to enter your most dangerous phase, the phase of being an invisible spreader. That's the peak infection period. But that's the point with the alternating quarantine. In week number 2, precisely at the time of your suspected peak infection, you're going to be staying at home. And then you're going to spend a week at home, and there are 2 options. If indeed you were infected in week number 1, then there's a good chance that sometime during week number 2, you will develop symptoms. Now you're no longer an invisible spreader. You and your household are going to enter quarantine until you're cleared of the virus. But if by the end of week number 2, you have not developed any symptoms, most chances are you're good to go. Either you were not infected, or even if you were infected, you didn't develop symptoms. Within a week or a week and a half, most people who do not develop symptoms are already not very infectious. So you spend your suspected peak infectious time at home, and then if you don't develop symptoms during week number 2, you can resume activity in week number 3 according to the alternating quarantine schedule. So what the alternating quarantine does is like a ratchet movement. Every week it prunes out the invisible spreaders and allows you a predominantly virus-free workforce within the week after. So the alternating, the weekly successions are in resonance with the natural disease cycles to prune out and to make sure that people are isolated at home when? Precisely at their suspected time of peak infectiousness. So those are the 2 reasons why, theoretical reasons, why alternating quarantine is a good idea, okay? 1, it sustains a 50% socioeconomic activity, but only 25% infectiousness. So it cuts R0 roughly by a factor of 4. And the second thing is that it naturally synchronizes with the COVID-19 disease cycle that has approximately 5 to 6 days, approximately 1 week to reach your peak infectious period, to somehow get you infected in week number 1. You sit down your suspected infection in week number 2, and if you're okay, you don't, no symptoms, you're clear to go in week number 3. And so within a couple of cycles, you get a predominantly virus-free population. So now the question is, does it work? And I have to thank my referees. Our referees, they were very strict with us, and they made us model this in the most detailed way possible. If one of you were the referees, one of the referees, I have to thank you here. So we used a very detailed modeling to test that. You know, part of quarantine strategies is that you need to distinguish, and you mentioned that, Spencer, in your the papers that you read to us, the difference between in-house infections versus out-of-home infections. And quarantines, they take the red links and crush them down, but on the other hand, they really exacerbate the blue links, the links within each household, because you spend more time within the house with your family members. So we created a society with families and households and daytime activity, which is mainly outside, versus nighttime or quarantine activity, which is only in the house, and tracked the propagation of the epidemic under different mitigation strategies. You've already seen the disease cycle we used. It was a very detailed disease cycle of COVID-19. There are also some things that, you know, society is not perfect. The synchronization with the disease cycle, for example, assumed that the majority of people become infectious within a few days to a week. But some people don't develop symptoms for 2, even 3 weeks, but they still infect. So we have variability across society. We put that in. And of course, I see that a lot, people talking about mitigation strategies and assuming that people behave like they're simulation. But we know that society is not perfect. So we also added compliance. People cut corners. Okay, for us, it's way more than cutting corners. We enable the fraction of 5, 10, 15, sometimes even 20 or 25% of defectors, people who flat out violate the rules and continue to be active even during the time they're supposed to be in quarantine. You can think of them not necessarily as defectors, also as essential workers, people who have to work around the clock and cannot take a week off. Okay, so we can also include them in. They're the same, from a mathematical perspective, they serve the same purpose. And the other question is, with all of these complications, so what did we observe? Well, here are the results. Since there's a lot of uncertainty, we ran many different scenarios, which is what you see here. There's a lot to unpack here. And instead of, and so, people see this graph and they start checking their emails or sending WhatsApp messages. Okay, so no, bear with me. I'll just focus on one of these scenarios just to show you what it looks like. So here are the different strategies. In orange, what we're following here is the prevalence, the number of infections versus time. And in orange, you see the unmitigated spread. And the unmitigated spread goes way off the screen, goes up to unmanageable numbers. We cannot afford that. That's out of the question. And then we have the two competing strategies. You see, in red and green, we have the half quarantine and the intermittent quarantine. The intermittent quarantine means week on, week off. That's why you see it squiggling up and down like a sinus, like a wave. Okay, but where is the alternating quarantine? Well, to focus on alternating quarantine, we have to look down here. In blue, you see the results of alternating quarantine, and there's only one thing that beats that, and that is what you see in green, is the 100% quarantine. So in green, what you see is the perfect mitigation strategy. Imagine that at some point in time, you lock down everyone at their house, nobody can go outside, 100% quarantine. This, of course, exists only in theory, but the reason we have it here on the graph is because despite the fact that it's theoretical, it provides a baseline. It shows us what you can achieve. You cannot go better than the green line. And the point is, with the alternating quarantine, the blue line is that, of course, it doesn't perform as well, but it's in the same ballpark. So it's pretty much currently the best mitigation strategy out of the ones that we tested over here. But there are other measures. It's not just about how many people are going to get infected. If we go down the disease cycle, there are several crucial junctions. First junction is that some fraction of the population, this guy with the H on his chest, is going to become hospitalized. And some of these people are also going to need ventilation. And every society has a cap to how much their hospitals can sustain and how much critically ill that need ventilation the country can support at any given time. Of course, most troubling are the people all the way over here. That's the mortality. That's the people who are going to die from the disease. So we tracked the performance evaluators based on these three numbers. We looked at the hospitalization, ventilation, and mortality numbers. And now what you need to do is focus on these bar plots over here. Again, many different scenarios. Let me just spread out one of them for you. So we looked at three things. The residual deaths. It's the deaths that your mitigation strategy was not able to prevent. Some of them are unavoidable, like people who were infected before you instigated your mitigation. You cannot prevent those deaths. You cannot turn the clock back, okay? But we looked at the residual mortality, the deaths that could have been prevented. And again, the half quarantine and the intermittent quarantine performed to some extent, but alternating quarantine really reduced the residual deaths by an order of magnitude more. Same occurs for the peak hospitalization and the peak ventilation. In all of these performance measures, very consistently, alternating quarantine allows a 50% economy, but outperforms its natural contenders and allows the same level of socioeconomic activity, but do not afford us with the same level of mitigation. Now, when we first came up with this idea, we published a very crude paper on the archive just to get it out and start circulating. We published our code. We asked for people to test the code and kind of improve on it if they can. And we were overwhelmed. We were approached by governments and by corporations and by ministries of education that wanted to implement this. And we decided to put together a team and talk about the actual implementation. So we put together a team with a virologist and management professionals and mathematicians and computer scientists all together to come up with a good implementation plan. And I want to cover just two aspects of the implementation. Here's where I need to remind you. We're looking at a strategy which is more resolved than the natural strategy. You can either lock down completely everybody, very good for mitigation, very bad for the economy, or you can just forfeit mitigation and sustain your economy. We're trying to benefit the best of both worlds. This requires to get out of your comfort zone and make a little bit of an effort in terms of implementation. Two things that we were asked by many of those committees and government ministries is how to partition society and how to enforce this. So I want to spend like 2 or 3 minutes on those aspects of the strategy's implementation. So how do you partition society? So here's the way I suggest it's going to go. Imagine that you were all convinced and that the governor of Texas has decided that they want to do this in Texas. They want to apply alternating quarantine. So the first thing that they need to do is that the governor has to, you don't have to do it tomorrow morning. The governor has to set a date and said, by this deadline, let's say February 1st, about a week and a half from now, we are going to begin with alternating quarantine. Businesses are held liable. They can only reopen conditional on them working in fully separated shifts. So now your boss, she has to start making a list and seeing how to best partition her workers. Of course, she might want to train Bob to do Alice's job because they need to do in different cohorts. Okay, so that's, you give businesses time to kind of think about how they can run this. And also you at home, you might consider what are your constraints? Like I'm taking care of my grandma, so we need to be in the same cohort. Okay, well, I want to be in the same cohort as my girlfriend. Okay, so you need to think about your preferences. And then what happens is this, the local authority just says that everyone who lives in, say, even addresses is cohort number 1. And everyone who lives in odd addresses is cohort number 2. Very simple. They don't need to think about it too much. And that way you get that households are naturally partitioned. Okay, it's very important that me, my wife, my kids, we have to be in the same cohort. Otherwise you lose the separation. Okay? And what happens if I'm assigned into an inconvenient cohort, or if my boss really wants me in the other cohort because there's an overlap? Well, conflict resolution is very simple. You do not need to ask for permission. You just inform. There's going to be a website. You just inform your local authority that you want to swap cohorts. As long as you do it before the deadline, every swapping request should be granted. Why? A, we want to make this as smooth as possible. We want to make this as fair as possible, and we want to make this as sustainable and easy for the population as possible. Now, how can we be so lenient? How can we be so generous? Well, it's very simple, because we do not need a perfect partition. So if you're a computer scientist, you can say, there's no way to solve this problem. It's NP complete. There are too many constraints. The point is, don't solve the problem. It's fine. If one cohort is going to be 55%, and the other cohort is going to be 45%, it's going to work. We don't need a perfect partition. So you just let the system arrange itself. You set the partition, and then everyone, because their boss asked them or because they have some other constraints, can just shift between the cohorts as long as they do it by the preset deadline. By the deadline, here you have it on the bottom, society naturally is partitioned into separated cohorts. There's no micromanagement of these cohorts, and all the employers and civilians are granted their preferred schedule. There's one condition. If you switch from red to blue, your kids, your wife, all your household switches with you. So if you have a conflict because you want to be in the red cohort and your wife wants to be in the blue cohort, well, that one you need to resolve yourself. I can't resolve that one for you. Okay, so that's society's partitioning, and now it's February 1st, society is partitioned, we start the schedule, and the question is how to enforce that. We're very close to the end. This is going to be the last thing I want to talk about. Okay, when people think about enforcement, what they think about is force, policemen, coercion, policemen chasing down civilians and making sure they are not violating the rules. But enforcement is not about that. It's first of all about motivation. You need to explain to people why this is important, why this is in their benefit. It's very easy to explain to people why this can work, so people cooperate based on motivation. Now, I know that's not enough. That's like having a diet saying, I will not eat chocolate. It's not enough. You break down at some point. So intrinsic motivation is just the first component. The second component is to create a framework. That's like not putting chocolate in the fridge. So you sustain your diet not based on your intrinsic motivation, but based on the fact that you created an environment that supports cooperation. And the last resort is really enforcement. If I eat the chocolate, I'm going to get punishment. But coercion is only the last resort. So let's think about the inhibitors. What might drive people to defect, to not cooperate? Well, the first thing is that people want childcare arrangements. They want to get rid of their kids. They want the kids to go to school, and they want to go to work. And the second thing is that people want to go to public centers to do shopping, to get errands done, to get things done at the local authority. And of course, lastly, you want to go outdoors for a stroll with your dog or get your kids running out on the playground. Those are the reasons why people might want to violate their quarantine shift. Now, they're not all of the same risk. So school and work is an extensive day-long interaction that's high risk. And going outside with your dog, well, that's a very low risk. We might decide just to forfeit that one. And now let's see how we can take care of each of these inhibitors. So those are the moderators that we can set down. So the first thing is about school and work. Well, the point is you can't cheat, right? When the local authority, by the deadline, has partitioned society, you can't send your child to school out of schedule. They're not going to admit your child. You can't go to work out of schedule because your boss is organizationally liable to work in shifts. He's going to incur a fine if he lets you work out of your shift. So the main two inhibitors are just by the natural framework lead you to cooperate because you cannot cheat on those. What about going out to public centers? Well, we need to appreciate several things about the alternating quarantine idea. You just need to isolate for 1 week at a time. So the drive to go and do shopping is not that strong. You can get supplies for a week. You need to instruct people that they need to get supplies by this Thursday for their next week. So people can supply for an entire week, but then there are always unexpected things like plumbing, or I have the fridge broke down, or we need a medication that was unexpected. Fine, so every local authority should have a support team. And that support team should solve those local instances where people have to somehow get out of home or get someone in their house. So they will assign you a plumber, which is also in the red group, to go and fix your pipe because he and you are part of the same cohort. So there's no cross-infection between the cohorts. And finally, it's very simple. You just have to issue a mobile app. Now, I know people do not like apps that are issued by the government, but let me be clear about this one. This app does not follow where you go. It doesn't read your emails and doesn't go into your bank account. This app only knows one thing about you, which the government already knows about you. It knows if you're in the red or in the blue group. So you want to enter a shopping mall, you have to show upon entry, just like today you get tested for fever, at least that's what they do in Israel, you have to show upon entry your app. And if you're in the red group and this is the blue week, you cannot enter. So except for like those, I don't know, hackers who might hack the app, 95% of the option to cheat here is completely reduced without even one encounter between a civilian and law enforcement. It's all based on creating a framework which allows you to cooperate by creating support and forces you to cooperate by creating a system where you cannot really cheat. What about going outdoors? Well, I can't enforce that without policemen. We haven't found a way to do that. So you can have policemen on the streets asking you if you're in the red, show your app, if you're in the red or blue cohort. But the honest answer is you have to go outside at least once a day if you have kids or you have pets. Plus, the risk on outdoor activity is so low, just let it go. Don't enforce that. And so you can have the alternating quarantine run by itself practically without any enforcement except for one enforcement, which is the enforcement of the authority on the businesses. But we have institutions to enforce on businesses. That's easier than enforcing on individuals. And here's the last point. We think of the alternating quarantine as an alternative to a full quarantine. And people say, let's play it safe. Let's do the full quarantine. It's better, right? I mean, alternating quarantine, only 50% isolated each point in time. In a full quarantine, everyone isolates. That seems to be better. The answer is that it's not exactly that way. Because you see, To mitigate COVID-19 through lockdowns, it's not enough to have a few days of lockdown. We already know by now, it takes 5 or 6 weeks to see a significant effect of the lockdown on the prevalence of the spread. And a 5 to 6 week, 100% lockdown is just impossible because people need to get supplies. And then, therefore, supermarkets have to remain open. And if supermarkets are open, supply chains are open. If law enforcement works, then someone has to supply their food and their logistics. So there's a whole set of services that you just cannot lock down for 5 or 6 weeks. It's just impossible. But what the alternating quarantine does is it sustains a 100% active society in this week and a 100% active society in the other week. So really, from an individual perspective, it only asks you to lock down for 1 week at a time. Now, a 100% lockdown where you really do not go out of your home, not to get supplies, not to get things done, not to fix your car for 1 week, that's doable. And therefore, alternating quarantine, in a sense, is more efficient than full quarantine. And we looked at the data, and it turns out that there is no country, even the most strict countries. Israel was one of the strictest countries when it came to its enforcement of lockdowns. Even the strictest countries did not achieve more than a 70, maybe 75% reduction in activity. Because as I said, supermarkets have to remain open, supply chains have to remain open. You just cannot shut down everything for 5 to 6 weeks. So we looked at 50% lockdown, 60% lockdown, 70%, 75, and 80%. And it turns out that alternating quarantine, for all the reasons I've conveyed to you, is pretty much as effective as a 75% lockdown. So it accomplishes the same level of mitigation as any practical lockdown that any country has enforced, even the strictest of lockdowns, but it accomplishes all that without completely crippling the economy. Now, we are now seeing the vaccines. I already told Becky when we chatted before, I'm getting my vaccine tomorrow morning. So we're starting to see the end to all of this. But the point is this. We are going to see more outbreaks. First of all, because it's going to take time to roll out the vaccines. Second of all, because there might be mutations. And the higher the prevalence, the higher the risk of a vaccine-evading mutation. Plus, even after society will be completely vaccinated, it's pretty clear that we need to be ready for the next outbreak. It's going to happen within a year, 2, 5, maybe a decade. And so everyone should expect their government to have a plan. In COVID-19, we improvised. It was our first COVID-19. But our second COVID-19, we should already expect our government to have a plan made to instigate the epidemic. What I suggest is that alternating quarantine should be that plan. And the time to start thinking about it, well, it was half a year ago, but if you didn't think about it half a year ago, the time to start making the details of this plan is definitely now. Of course, I have to thank my lab and thank you for listening. And also mention that, yeah, it's not that simple. So models have limit and there is infections in the house, which we actually took care of. But mainly, as we were discussing with different governments and different societies and different corporations and schools, we found that it's not a one-size-fits-all. So there are definitely country-specific adaptations. Some countries are very strong in the high-tech sector, which can sustain the full lockdown without much trouble. Others are more industrial, and if you're industrial, alternating quarantine is a very good solution for you because factories can easily partition their cohort and work in shifts. And we also talked with many representatives of the business sectors, and it requires some fine-tuning and compromise. But I hope I've convinced you that it's all worth the effort and should be our plan, maybe for the next months in COVID-19, definitely for the next outbreak after we roll out our vaccines. Thank you very much.